All right, folks, we are live. Come on in. I figure I'm going to try a little one this evening and see how we do. How you like my new channel thumbnail I threw out there? Try something a little bit different, see how it works out. Going to give myself a shout out here to other people on the different platforms. Just give me a second. Going to share us out. Share us out to Twitter. Gonna give myself a little tweet. Boom. Easy enough. I tell you, that's so nice. It's very convenient how you can share that out to the Twitter account. Very easy. I mean, most of these are pretty simple. Don't get me wrong, but it seems like that's probably one of the easiest. Literally 2 buttons and boom, you already have sent out the post or shout out. Alright, shout out to Facebook. Matthew Belliker. Matt, what are you doing? Matt's in the house. Bring some great information tonight, Joe. Oh my Lord. Matty B. You got a purple icon, Matt. What's that all about? You gone purple on me? We'll see what I get here in a few minutes. Now this is the first time I've done a live stream on Thursdays, and I think I'm actually going to do a live stream tomorrow. They got me flexed off of work tomorrow now. They're cutting back a bit on us, so I thought it was low profile. Ha ha ha. Not with a last name like that, it's not low profile. So I've never done a live stream on Thursday. It's going to be interesting to see who I get in here. I normally been doing them on Wednesdays and Sundays, and so I'll see what happens here. It usually takes people a few minutes. I don't think there's too many live streams that go on crazy enough as big as YouTube is. There's not a lot that goes on Thursdays. People end up dropping their new video on Friday, and so they're spending tonight doing that. So I might not even get a lot of people just because they're working on their own content. Got 4 in the house right now. That means I got 4 viewers somewhere that aren't in the community. That means they're not able to do comments like my brother Matt is able to do. They're probably either seeing me through either the TV, which would be quite scary. I know, as handsome as this young devil face is, or my brother Scully here. Oh, BET's in the house, Brown Eye Trucker. Nice to see you coming in. I told you I'd do a live stream on Thursday. I was trying to get my thumbnail. I'm trying to get a different thumbnail, and I got it working. But man, this program is very picky. If you don't have, your wording, your lettering, the coloring, and everything just right, it keeps saying that the size is too large, just because you might have a letter out of the actual parameters, or the dimensions, I should say, and all of a sudden it won't upload it. So I fought for about 20 minutes. So I should have started it just a little bit after 6, but I've been fighting with this thumbnail for the last 20 minutes. Thumbs up the stream, that's right. Thumbs up the stream. So tonight I thought about, what am I going to, I've started to change the channel itself a little bit in regards to, Dr. Know-It-All, Cool Cats, Scully, what am I going to do next? Who am I going to bring in? And so what I'm going to do, I'm going to start this weekend, I'm going to start doing, a quote-unquote season. And so I'm going to start out with probably the best video I've done so far in regards to the views that I've got. I think I got over 1,300 on my snapping hip syndrome. And so I think I'm going to do several videos specifically just on the hip itself and snapping hip syndrome. It seems like, man, it's ridiculous. I did the snapping hip video probably almost 4 months ago. It wasn't too long when I started out. I did that video, so I don't have any of this Adobe software program or Scully or any of this other stuff that I had done when I made that initial video, and it just got legs, man. That legs, for some reason, that video has got legs, and it just keeps on going. And so I guess it's a testament to the content itself. So, you know, I should be up for the challenge. I'm going to try and make, and I'll be curious how well my next couple videos go, because it's the same kind of content. I'm just adding a little more pizzazz to it, so to speak, and I'll be curious how well it does in regards to, you know, do people just like the content and they don't really give a hoot about anything else? Now, they always care about the models just because it's you know, it's always visual. It's easier to describe certain problems, as my brother Matt already knows. But all the other stuff, the coloring of the video, the sound of the video, the special effects sounds, the special effects graphics and stuff that I do, we'll see what happens and see if people actually like that as well as the content. To be continued, we'll see. So my first one I'm going to do is I'm going to this Saturday, this Sunday I'm going to try and drop it. We'll see. This is probably going to take me a while. But I'm going to do just snapping hip and the 3 types of snapping hip syndrome. Matt knows this stuff better, or probably I know he knows it just as well as I do, if not better. You know, we have internal snapping hip, we have external snapping hip, which it means what I did on my initial video 3-4 months ago was all about the iliopsoas, and that's the muscle. It's 2 joint muscle, or one comes from the spine, from basically the lumbar spine. It comes down, and then you have another muscle on the inside of your pelvis here. They combine and they turn into one muscle, one tendon, and wrap around underneath your hip here, and actually allow your hip to rotate outwards. It's one of your main outwards. I was thinking the piriformis. It's your main hip flexor or hip muscle to bring your leg upwards, or if your hips are solid in place, allows you to bend forwards. And so you can have a snapping on that area. You can have a snapping at the IT band, the iliotibial band, and also you can have a snapping of, unfortunately, if you have a labral tear. And so those are the 3 kinds of snapping hips that you can have. And that's really going to be the gist of my first video on Sunday. And then, so I'm going to try and make my videos a little bit shorter, like 5-6 minute videos versus 10, even though I know YouTube's algorithm likes 10 minutes and more, because they can add more advertisements within a 10-minute or longer video. The reality is I want to, most creators that are in my niche, like Bob and Brad, Dr. Joe, there's another guy that he's a physical therapist assistant with a physical therapist, and he doesn't do my stuff. He does more instructional stuff in regards to what is physical therapy, how to become a physical therapist. So he does that kind of viewpoint, not evaluations and treatments and stuff like that. And so their videos are basically between 3 and 5 minutes. You got a couple of Bob and Brad's. They've done some longer ones when they bring in a friend or something like that, or someone that's trying to sell them something, like a traction machine or a tennis unit or something like that. But most of their videos are quite small, lengthwise, excuse me. And so I'm going to start and make my videos at least this season of HIP. I'm going to make those videos 5 to 6 minutes long and make more of them. And I'm going to start out by the instruction part, and then I think my next video is going to be injuries, or how the injuries occur. And then I think my third one is going to be treatment techniques that you can do in your home, like I always do. And then my next one's going to be treatments that you would receive by a physical therapist. And then I think we might do surgical, like the labrum, because that's one of the parts to the snapping hip. So that's how I am kind of visioning, at least, what do they call it? Softball and spitballing it. And literally, I'm doing this off the cuff as I'm talking to you guys, and so that's how I think I'm going to do the next 6 to 7 videos on snapping hip syndrome and see how it works out for me. Oh, I got God in Common House. Thank you so much for coming to my Average Joe. You're welcome. You had it. It was short. It was awesome. You'll probably get a good click-through rate because it's a shorter video. I like 10 minutes of more when you're monetized. Yeah. Well, the reality is this. Most people, even when they make a long or short video, if they're a small YouTuber, let's say they have 5 or 10,000 subscribers. I know that doesn't seem small, but in reality it still is. Because you're probably only getting like maybe 2,000 views or 25. At least that's what I see when I look at the landscape of small creators and where their channels are subscriber base wise and how many views they're having per video with the amount of subscribers that they have. I really do see that it's between 5 and 10% of their entire subscriber base is actually watching their videos. Subscribers and non-subscribers kind of combined is all I can see as a viewer. As the creator on the back end, each channel we can see how many people are that are watching their subscribers and ones that aren't. But anyways, I digress. Most of that is basically front-loaded with the videos and the monetization. People are putting like, probably most, if they're going to watch, they're doing the 30-second and maybe the 60-second commercial on the front end of their video, and then they might do one at like, 3 minutes, 5 minutes, and then one towards the end. So the reality is, even if you don't make a 10-minute video, and most people are watching maybe 50%, unless they really like you and like your content, you're lucky if you're getting 50% of your video watched. So what's the difference if it's 10 minutes or not? Because they're never going to watch that commercial anyways. So I got 4 in the house. I'm kind of running slow at this point, so I'm going to see how Thursday night does for me, because like I did last night, that 7 o'clock witching hour comes in, and all of a sudden I start to get a lot more. Emma Art's in the house. Emma Art, hi. Hi, how are you? I got a new one here. If you guys don't know this is a new one. Thank you so much for coming. If you'd like to subscribe, if you haven't already, to my channel, I would appreciate it. Scully and I would love you to subscribe. Probably more like Cool Cats, Dr. Cool Cats, because Dr. Know-It-All, he's an idiot. He doesn't listen to anything. I'm good. Hope you are doing well. I am doing well. I am doing very well. Knock on wood, or something just as hard. When it comes to the virus and stuff like that, I'm faring out, at least so far, obviously better than most. So I thank the lucky stars and everybody else for that. Do you guys have any questions so far? So that's what I'm going to do this show this weekend, and where not my live streams, but at least my shows, I'm going to do kind of like a series and see what happens. And then I'm going to start with that content that really makes has made at least my view count the highest so far for views wise, is the snapping hip one. So that's just logic sense to me that I should probably, if I'm going to do a series, I probably should do one that at least I've had a lot of views, and I can even pull my that thumbnail, as well as I can probably pull my what's the word? I have clip art in my head, but that's not what I'm talking about. I'm talking about I'm completely fumbling my words at this point, but I'm trying to think of on the back end when we make the video and we put those other little not clips, but phrases in, whatever those phrases are called. Oh my Lord, this is terrible. It'll come to me. Isn't that awful when you're trying to think something really hard and it's like a black wall, a brown wall, or white wall of just can't get through it and can't remember that. Thumbs up the live stream. Yes, thank you so much. Hopefully connect if you guys are new to here. Hi Nicole. Yes, Nicole. Nicole is back. I hope you're doing well. I hope your family member is doing well. The one that had the big cancers. I hope they're feeling better. So let's talk about the hip a little bit. So that's what I'm going to be talking about over this next show. If you guys have any other questions or you want to connect with some other people that are in here. Some people are content creators and some people aren't. They are not dummy accounts or fake accounts. They are real people. I can promise you that. I personally can attest to Matthew Belliker myself. He's really a brother from another mother. He really is. I view him as a family member. He is awesome, and I have nothing but good words for him. All right, and so let's go ahead. We're gonna take one of these hips out for a second, which is cool that I can do with this absurdly overly expensive model that I bought. Yes, Matt, I spent a muku dollars on this. I know, I'm a crazy therapist, and yes, what can I say? You know, get busy living or get busy dying. That's a shout out to Matt. He knows that one. Oh, Controversial Beaver, thank you for coming back, sir. You're too kind. I watch you because I'm the PT world. You're truly one of the best. Oh, thank you, sir. Much love. All right, so let's go ahead and talk about the hip. So we have this ball, and we have this socket. And I talked about, let me make sure I don't spill my soda because I can see the back end of this dumping over if I hit the top of the base of the skull with that soda. That would be terrible. It would stain my carpet and my wife would be mad. And so we got this ball, and literally on the end of this ball you actually have an artery here that it goes into the socket. And if that thing gets disrupted at all, we have a thing called AVN. It's called avascular necrosis. And essentially, that's what happened to this guy a long time ago called Bo Jackson. Bo knows. He was one of the first kind of professional players that did two professional sports at the exact same time. He played baseball and he played football. Unfortunately, his hips gave out on him. He had to have hip replacements, and that was the end of his career. That guy had endorsements out of the yin-yang. He was a beast back in the day. And so, needless to say, if this artery gets disrupted at all, whether it's through wearing and tearing on the joint, or maybe you had some sort of what we call abnormality, what you were born with, some sort of, if you were as a child, and what you shouldn't do is what we call W sitting, where literally your legs are in a W-shaped position, and that can cause, as we age, this socket deepens. And so when we're young and we're growing, weight bearing correctly through our hips makes this socket deeper. But if you're a kid and you're always W sitting, it's really going to mess the shape of this socket up and also wear the cartilage in the hip incorrectly. And that can also lead to problems down the road. I got 5 in the house right now. You guys have any questions about anything else, just shout them out. Go ahead and connect. Hit the thumbs up or thumbs down if you think my content isn't very good. But at least you thought about it. And that's what I like. You know, whether it's a negative or a positive, at least you thought about it. And that's kind of cool, at least from that standpoint. And so that's an issue with that part. And so, you know, who knows if Bo Jackson was a W sitter or he had something else going on. But needless to say, he lost and had to have hip replacement. And back then, I'm sure he's probably had at least another 1 or 2 revisions since then, because back then those old types of material for hip replacements, the ball and the socket, aren't as good as the material that's made today. And so he's probably had to have a replacement at least one other time by now. I got 3 in the house. I'm dropping down like a rock. I started out with 6 or 7. What's wrong with these people? Don't leave me. Don't leave me. Scully, they're leaving us. Shameful. Can't believe this. All right. Anyways, so you have cartilage on the inside as well as cartilage on the ball. And if any of that wears incorrectly over time, that can give you osteoarthritis, which is a form of basically old age wear and tear, and that can happen earlier in life, especially if you have a couple of these problems, or if you're just morbidly obese and it wears on the ball and socket, because for every 1 pound you're overweight in the hip, it's 3 pounds of pressure. And so that excessive pressure over time can wear down the cartilage, and you end up needing a hip replacement much earlier in life than you actually should have needed to. You know, they're doing hip replacements earlier. Man, I've seen some in their mid-40s now getting hip replacements. So, I mean, it's real. I mean, I would have never thought, and I'm sure, Matt, if you're still in here, would have never thought early in our career that, oh yeah, someone in their 40s is going to get a hip replacement. I mean, it was like if you weren't 60 or older, they weren't even thinking about doing a hip replacement. They were doing injections and non-compressive type exercises, stuff like that, telling you to lose weight, stuff like that, because they just knew the hip replacements weren't going to last that long if you were in your 40s. You know, if you're going to live another at least 40 years, those hips weren't designed, this hardware wasn't designed to last that long, and they knew you were going to have another revision. I'm still here. That's right, BET. Much love goes out to you, girl. Stick and stay. That's what they say on, G-Kicks? I know G-Kicks, boy. He's got a large subscriber base. He don't have too many people watching his videos, though. If you see his views, man, which he's, and even Gype or whatever, or these other people, they got huge subscriber bases. Their views, they're not getting many. If you look at their, maybe 3%, 4% of their entire subscriber base. If you look at it, I mean, 150, maybe 200 views tops. For someone who's got like 8,000 and 9,000 subscribers, there's none of their subscribers are watching their views. I mean, watching their edited shows or edited videos. All right, and so we have this top of the hip here. This is all one side, and so we look at this as an inanimate. All right, you have all parts. So you have an ilium, you have the pubis here, this cartilage in between, pubis symphysis. You have the rami. Okay, so this all one part. You have the superior rami, the inferior rami. And you can get fractures in those areas, car accidents and stuff like that. And boy, when we have to get people out of bed, they got to be really doped up, because a lot of times they don't do surgery on these. If that's a that's the soda. If this is a non-displaced fracture, which Matt knows what this all means if he's still here, but my average Joe peeps, so I'm going to keep this on the down low, Matt, if you're still here. So a non-displaced is basically a bone that doesn't shift and move; it stays in place. And so even if it's fractured, they're not going to do surgery on it. They're just going to tell you to be careful with it, and they're going to dope you up and probably get therapy in there to get you moving and get you probably out of the plate, get you out of the hospital. And then on the back end here, we kind of flip you upside down, woo, and we take all the organs and all the bowels and everything out of you. You have these two bones here on each side, and these are called your ischial tuberosities. And these are where your hamstring's attached to, as well as a lot of other things, but the two big muscles I'm thinking off the top of my head are the hamstring muscles. And they're obviously really long, starting way up here and go all the way down. And these are where you should be, when you're sitting correctly, you should be sitting on these bones. But a lot of people, unfortunately, are sitting on their sacrum and gapping their L5S1 and getting a lot of pain. 5 in the house, 5 in the house, 5 in the house. All right. So we have the ASIS, which is the anterior superior iliac spine. That's why we just say ASIS, because unlike the geek world like I'm in, most people can't remember that, so they'll just say ASIS. These bones are very important. You know why they are? It's because we do measurements when you have a leg length or when your leg seems longer than the other. These are the points that we take the measuring tape at, and we start here and we go all the way down the inside of your leg and go to the bone on the inside of your ankle. See? That bone right there, the end of your tibia or shin bone at the very end here is called your malleolus. And since it's on the inside, it's called your medial malleolus. And that is where we stop at. And so hopefully the measurement is the same or equal on both sides. If it's not equal, we need to find out why. Is it truly a leg length discrepancy? And if it is, where is it coming from? Is it coming from your tibia? Is one tibia longer than the other? Is one femur longer than the other? And we can do that by putting someone in a hook line position very quickly as professionals, and we can really figure that out fairly fast. And so depending on someone's walking pattern, we'll also be able to see what's going on too. There's a couple of different patterns. One's called vaulting, which one leg is obviously longer than the other. And that's a certain walking pattern. Or if the hip is dropping on one side or the other because one leg is shorter than the other. Or it could be what we call a Trendelenburg gait pattern, where one of the glute muscles on the opposite side is weak and the hip is dropping every time because your muscles in the hip aren't keeping your pelvis level and one side's dropping, and obviously it's the opposite side, which can be tricky when you're first learning this stuff. You know, you think the side that's dropping is the weak side. No, it's the opposite muscle on the opposite side. So if your hip's dropping on the left, that means the right side is the weak side. And I want to say me too. Thank you, Nicole. If you guys have any questions, I'm going over the hip, but I can go over anything else if you guys want to. I got basically everything here. Hey, Matt, if you're still there. Oh, I should have asked. Darn. Matt, I'm still hanging in there. Hey, Matt, are you still using that full skeleton? If you're not using that full skeleton, give me a price quote, because I want to buy it if you're not going to use it no more. And I'm serious. I'll buy it from you. When I go up there this summer, hopefully in July when we go up and see Joanne's family, I'll stop in and I'll pick it up if you want to sell it to me. You just throw me a price quote. You don't have to throw it in now if you don't want to. Think about it. If you're thinking about selling it, I'll buy it off you. Okay, and so that way I can demonstrate the entire spine, as well as Scully can have a buddy, and we'll have the ribs and stuff like that, as well as the rest of the upper extremity, because obviously that's what I'm missing right now. I'll let you know. Thanks, Matt. Okay, and so the next thing we have here, and this is one of the, when we talk about the ball and socket, when we talk about snapping hip, and the third type of snapping hip is caused by a labral tear. And so what the heck is a labrum? Well, we have a labrum in a couple spots. We have the biggest one, we have one in our shoulder, and I've talked about that to ad nauseum on my shoulder. Hey, Scully, move over just for a second, brother. And so the glenoid, which is glenohumeral joint, is this whole complex here, and this whole thing being the shoulder girdle complex, the clavicle, or the collarbone, and the scapular shoulder blade, and the ball and socket. The socket part is the labrum, and so on the shoulder, the labrum basically is essentially the socket. Without that labrum, the socket itself is very shallow, and if we're just saying that the ball rotating in the socket is too shallow, but that labrum for the shoulder deepens that socket and actually gives that ball the ability to move like it can, basically floating on our body, except for at the sternum area, or the mambrium, which is the body of the sternum. But anyways, that's another story. And so in the hip, we have the same kind of thing. We have a labrum, but obviously it isn't as well. It is defined, but it's not as big as in the shoulder, because we have a very deep socket to begin with, and you would need that because this is a very large weight-bearing part of our body, and you wouldn't want something floating like on a shoulder. It would be a disaster. The human body wouldn't work that way. We would have been eaten up by lions and tigers and gone by the wayside a long time ago. So needless to say, the labrum really helps the ball a little bit, but when that darn thing has a tear in it, it can catch or snap. And so you can have that deep in groin pain and refer downward in the groin coming from the labrum. And really what we call the gold standard for the labrum to test is actually a contrast MRI, where they literally inject dye within this joint. Then they go ahead and throw you in an MRI, and that contrast lights that whole area up, that labrum, and they can see right there where it's causing the problem or not. So that's a nice, if you have a labral tear and it's symptomatic, because you can have plenty of labral tears in the hip as well as in the shoulder as we age that are asymptomatic or no giving you symptoms. You can thank Latin for that. A in front means no, or the lack of. And so in this case, it's asymptomatic or not giving you any symptoms. And so the reality is also the MRI could be a false positive. You get the MRI of the dye and it shows that's where the labral tear is, and you go ahead and have that surgery, but you still have the pain. Well, unfortunately, that's not where your pain was coming from. Hopefully you don't get the placebo effect of surgery and your symptoms goes away. So sometimes you don't know, fixing the tear, whether that fixed it or whether it was a placebo effect. But anyways, we got 6 in the house. I'm still here. Thank you, MR. I appreciate you. I shouted us out live stream on Facebook, and I didn't do it on Instagram, but I did do it on Twitter. Oh well. Anyways, if you'd like to share me out, that would be great. I'd love it. I appreciate it. Okay, and so that is the third kind of step that I'm going to talk about in the 3 types of snapping hips that you can have, the third one being the labrum. Now, sometimes they'll just do a steroid injection with lidocaine. So they'll do a 1% lidocaine drug, which is a numbing agent, and they'll do a Depakote, which is this type of steroid that they'll do, and they'll have the 2 together in a vial, and they'll inject that area and see if they can just calm down the inflammatory process that they think that's going on from the tear and make that asymptomatic again. And so then you go to physical therapy, and then everybody's all happy. Hopefully, and the reality is, once someone hears that they have a labral tear, they fixate to it so bad, and Matt can attest to this, that sometimes it's almost impossible to sell them that, look at, you have a tear, but you could have had that tear for 20 years, and now it's just giving you some symptoms. And so this, but unfortunately, people get locked into something, laser focused, and sometimes it doesn't matter how much you bang your head against the wall. They're so focused that no, therapy's not going to work. I got a tear and I need to have surgery. And they come for 2 sessions or 3 sessions if you're lucky. They don't do any of the stuff that you tell them to do at home. Lo and behold, they don't get any better. Look at that. They didn't do what you told them to do. Wow. Self-fulfilling prophecy, right, Matt? I'll tell you one thing, Matt. There's some days I miss working with you, brother. I think about you a lot, even though you probably don't realize it. Matt, myself, and a guy named Brian, we had a really good time there for a while at a clinic in New York State. I got a good family where I'm at now, but, I do miss those times. You don't realize what you got till it's gone. Even though some days were a grind, brother, and I'm sure you would say the same thing, but, all in all, at the end of the day, we really did I thought we had a good time. All right, so the next thing, we're going to put Big Bertha here back together. And so the second problem is this iliotibial band. Now, back in the day, people thought you could stretch this band. Well, there's tons of research that I've read lately. The thing is more ligamentous, and so you can't stretch a ligament. Well, you're not supposed to anyways. If you stretch it, becomes sprained, and if you sprain it too much, it becomes a tear. Then it makes the area unstable. Next thing you know, you have a real problem. So, but there's a couple muscles that attach to this iliotibial band, one being the gluteus muscle, and there's three of those. There's the gluteus maximus, the gluteus medius, and gluteus minimus. That's right. Oh my God, there's more than one muscle for the gluteal. Yes, 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 that's exactly right. And so you also have the TFL, the tensa fascia lata, really tiny little muscle coming off the end here and coming to that front of that hip. And boy, sometimes I have to ultrasound and massage the snot out of that thing and tape it because that darn thing can get inflamed. That tiny stupid look, that tiny, if you ever look and type in TFL anatomy in Google and see how tiny that stupid little thing is, you think something so small would make a big difference. Where is that from? Was there a movie that was from? Let me see if I can throw a shout out to that. Man, I can't believe this little thing could do such a big problem. That's right, Doc. Everything is made in Japan. What? That's right. Now we can say everything's made in China and everything is brought to us from China. Bad and good. Oh, I got BET. I want to see you put a skeleton together. I saw some preschoolers doing it in my sister's classroom. I thought it would be cool. They don't know the proper names of parts, but they knew where the bones went. Back to the Future. That's right, brother. Da, 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 da. That's got to be one of my most... Oh, God, that's that first movie. Matt and I would do quotes all the time. There's a guy on TikTok that I watch, because I have a TikTok. I don't have a TikTok channel, but I do watch a couple people. There's this guy, Joe Godet, or Godet, or something like. It's kind of weird like that. His name is. He's a professional voiceover actor, whatever you want to call him. He has his own company, sound booth and stuff like that, and he can do a dead-on impression of Michael J. Fox in that role as Marty McFly. It's just dead on. He does some Arnold Port. If you have TikTok, anybody, and you see Joe Godet, he's funny. He doesn't swear at all most of the time, and he's pretty much clean fun. He does a lot of impressions, and he can dance. He does some good Michael Jackson moves. I was quite impressed, but he does some really funny stuff. But anyways. Anyways, BET, yes, I know I'm not putting a skeleton together. Hopefully Matt is nice enough, he isn't using his, he'll sell it to me. And, excuse me, and so I'll probably have, if he sells it to me, I should have it sometime by the end of July on the channel. I'll probably put his name on it. Maybe I'll even, if he lets me, I'll take a picture of his face and I'll cut a picture out of it and I'll put it on the skeleton. It can be part of my channel. Oh, that would be awesome. Of course, I don't know if that's legal or not. He would have to sign off on that, especially if I get monetized. If I get monetized, he probably would make money off of the videos. That might not be a bad idea, Matt, if you let me do that. You probably could get some money off of just copyright when I get monetized on the videos that have views for the one that has your picture or your face on it. My mom having very bad knee pain. She can't sit. If she sits, she can't get up. My mom is 60 years old. I feel bad for her. Oh, yes, the good old knee joint. Huh, I got one here. Look at that. And I'm telling you, Matt, if you're still there, I got this model, man. This model back in the day was probably like $75 to $100. This is I can unscrew these ligaments and they come off. This is fully articulating. This actually comes down and rotates like that, nice and easy. This is a very strong, sturdy knee. It's got the nice blue representing the meniscus. And this thing I picked up for like 19 bucks. I mean, I can't believe how good this is. And so, of course, it is during the pandemic, so I probably got a good price break because there's probably a million of them in a warehouse somewhere, and they probably just want to get rid of them. Anyways, that's a nice model for sure. Yeah, I mean, this thing is sick good. I mean, this thing is really, the ligaments are nice and strong. Like some of these things are frail, they break easy. got the nice ACL and PCL, obviously PCL in the back and the ACL in the front. And so I can unscrew these and actually all three sides, and this will start to come off and screw it back on. And so I was like, dang, really? Because a lot of times these ligaments, they're solid, and you can't take this apart at all. And if you do, obviously you've ruined it. So needless to say, I got a really good deal on it. But anyway, so let's get back to your question there, Emma. And so yes, if she's 60 years old, unfortunately, we can talk about, a lot of times if she is overweight, I have no idea. I don't know your mother at all. But for every 1 pound you're overweight, it's 4 pounds of pressure on your knee joints. And if you do that for long enough, you're going to wear down the cartilage. You have smooth cartilage on the actual bones themselves. The actual, this being the femur and this being your shin or tibia bone, and this being the knee joint as I bend it up and down. This kneecap has to glide up and down as your knee bends and straightens. And so if you have any wearing of the cartilage behind the knee, and the kneecap itself has got grooves in the back that glide, or what we call articulate or move with your femur bone, and so the reality is, if that's worn, or if it part of the femur bone where it kind of glides on the kneecap, that's worn, or if the meniscus are thinned out or frayed down because of that, and you have a lot of maybe pitting in actually the knuckle part of the femur, the osteoarthritis, and so that can cause a lot of pain. I'm lucky, I guess I always get 80% views. Well, yeah, bro, yeah, Emma, that's amazing. I mean, my 80% views, that's crazy. That's awesome. I mean, I probably float between 33 and 35 that watched my entire video. I get 80% for the first minute and a half, and then it drops off. I'm not sure what they think my thumbnail and stuff basically describes what's going on. And the algorithm basically says that if someone watches you for a minute, they'll watch you for 3 minutes, which is false, at least from my standpoint, over the last 5 or 6 months that I've been doing this. Gotta step out for a work call. Great material so far. I'll be back. All right, Matt, thanks for coming. All right, and so your mom might want to check into injections, conservative injections, where there's a company that they inject needle-wise a type of material that kind of lubricates and fills in some of those craters in the knee, and that might reduce a lot of the pain. And so your mom might want to look into that. I know one company's called Synvisc or Synvisc injections. And so not just steroid inflammation, but I'm talking about the type of injection that actually is long-term, that can kind of coat the knee joint a little bit and maybe reduce some of the pain that they're having from arthritis. I got 5 in the house right now, and I have like 2 or 3 videos on that. My mother-in-law tells me that I have to do a video on knee replacement, so probably sometime this summer, I promise you, I will do a video on knee replacements. The reality is I didn't really get a good view count on my hip replacement. I got maybe like 70 views, 80 views overall. I've had 150, 200 views on a lot more of my videos, so that one didn't do as well. I don't know whether I'm just too small yet. I've only made, I think, 73 videos so far. That seems like a lot, but the reality for the type of content that I make, it's not a lot. 150, 200 videos is probably when we start seeing the stuff out there. So, all right, and so let's talk about the hip a little bit more. Let me get a little small guy down here now. It's easier to move around with. The back side, so if we flip it around here, kind of show you 2 points here. So if we flip around here, the back side here, we have we have part of the hip here on the backside that actually makes up your SI joint. So your S is the sacrum, and the I part is your part of your hip called your ilium. And so that's the reality. This whole part here, this whole bone here, it's all one solid bone. Now, in anatomy, we learn there are different parts to it, and we depending on what muscle or tendon attaches to that area, we've talked about all these little bumps have names to them. So we named a couple of the larger ones already. So when we flip it around here, we have the PSIS, so the posterior superior iliac spine, and we have the posterior inferior iliac spine. And so that kind of gives us an idea. These are landmarks for us when we're looking at the SI joint or the sacrum and also the lumbar spine, when we can kind of come across to the two little dimples that skinny people have, and we can kind of come across and see where we're landing at between L5 and S1 here. We can actually get an idea of what's going on, as well as when you're lying down flat on your back and we're looking at the hips, we're kind of making sure they're level across, that one's not rotated and maybe giving you some pain. So these are all kinds of different landmarks that we look at, that we can see and figure out, one of our tools, quote unquote, in our chest that we use to try and figure out what's going on with you. Happy Lux! What? Happy Lux is in the house. Now this guy is awesome. He does live streams all the time. He is crazy. He's got a green screen. He's got flashing lights and music and all kinds of crazy stuff. His live streams are huge. When I used to go to him all the time, I mean, it was nothing to see, 80, 100, 125 people there. And so shout out to him. Thank you for coming to see a small live streamer like myself. I probably don't do it consistent enough to get your type of bank, but unfortunately I do a little bit of live streams and I try to do more shows. But it seems like people like my live streams, and so of just kind of going through different things, types of pains, type of treatments and stuff like that. So woo, I got all kinds of icons. So that's Mr. Happy Lux. If you like him, you can go ahead and subscribe to him. He's pretty cool. The reality is he's got a huge channel, and he might not see your stuff again. I mean, he's got thousands and thousands of subscribers, and so he's not going to be able to come and see your stuff just because there's just not enough time in the day. So I'm very excited that he was able to come to my live stream, because the reality is he's got a lot of people. If you like me, go ahead and give me a thumbs up for my live stream. I appreciate that. I got 4 in the house right now, I think. And so when we look at this back side here, any part of this can get irritating and get rotated. And so when we look at this SI joint, this joint right here where my finger's at, you can get where your hips actually, one side will rotate. On the opposite side, you can have it what we call an SI joint dysfunction, and you can get a lot of pain down in that area. Now sometimes for us, we need to, as a therapist, we need to rule out whether it's coming from the lumbar spine or not, or if it's coming from someplace else, but usually we try and rule out the lumbar spine, because that's the most obvious thing that could give you pain down in this area, besides some sort of SI joint dysfunction. As well as this sacrum here can actually tilt. It has a tilting mechanism, and so if a good friend of mine years ago, he went to a course and he kind of showed me this little thing where your sacrum kind of moves. Whoops, that's one of my notes for my next video. Goes on an axis, and so your sacrum can go this way, or it can go this way. And the reality is it can get irritating and get jammed up in there, and boy, you're gonna have a lot of pain with that, and you'll definitely need to see some of my stuff, or see a physical therapist, or maybe have SI joint injections to try and get things to calm down so that you can get that thing freed up and moving again. BET is giving me a kiss and a green heart. 7 in the house. What? If you could shout me out, Happy Lux, that would be awesome. I know you don't have to do that. That would be awesome. All right, so that's a huge problem right there, that SI joint getting jammed up. I did a video a while back that talked about doing mobilizations, self-mobilizations to the SI joint to get it freed up, so you can look underneath that. I think it's under my back playlist if you know anybody that has an issue back in that SI joint hip area, down in that area. You can have them look at my stuff. I go into treatment approaches and trying to figure out whether it's coming from the lower back or that particular joint itself. So that's one idea. This joint right here moves in the opposite direction. And they're like, what? That's right, it does. And so as I bend forwards, that SI joint and that sacrum moves in the opposite direction. And so you get this kind of movement going on. So when I go back, sacrum goes in. As I move forward, the sacrum goes out in the pelvis. So the pelvis and everything moves in the opposite direction. And when it doesn't move in the opposite direction, when it's stuck, you have a lot of pain. And that's not a good thing, because you can't sit. You're going to be doing a lot of this a lot. You might be sitting on a donut. You're going to have serious problems trying to sleep. You see this, I see this generally a lot of car accidents, people who miss a step. You know how sometimes you think you're stepping off a curb or stepping down a step and it's not there and you just drop further. You know how the whole, you get that whole thing going on and you cause a shift and everything tries to tighten up, and when that happens, oh man, that's when you can have an SI joint dysfunction. Slip and fall, that could be another thing where you slip and fall and jam it like that. That could be classic SI joint. Give me just a second. We got 4 in the house. I'll be right back. All right, I got some food for myself. You know what I'm gonna do? I'm gonna shout us out. Oh, R3's in the house. R3, R3, thanks for coming. Thank you, thank you, thank you. I'm going over the hip tonight as well as trying to get connected. I put a new thumbnail out. Took me like 20 minutes to get that dumb thumbnail the right size so YouTube would upload it. It was giving me a heck of a time. Hope all is well. Yeah, everything's good. I'm probably going to do another live stream tomorrow because I don't have to work tomorrow. I got flexed off of work because of the stupid virus. So we'll see how it works. It seems like Thursday night I get a lot more people in the house than I do any other night, at least so far. Or it could be just random luck, I don't know. But, alright. So, we talked about all the stuff with the hip, the bones, any questions at all with that. I talked about the SI joint. I talked about the different types of snapping hip. And that's going to be kind of, I'm going to start my show on Sunday. Probably end up being Sunday afternoon by the time I get it all done. And I'm going to be doing a series on just snapping hip. We'll see how it goes. Hi, R3. Hey, Joe. Okay. Okay, and so there's these, like I said before, you have these bones on the backside. We have names for those, PSIS, so I talked about that already. We have this huge bone, this huge notch here, and I've talked about this in the past. This huge notch right here. This is also part of the pelvis too. This ilium, this is giant, and so this little cutout here that everybody has is where the sciatic nerve goes through. And your sciatic nerve is a huge bundle of nerves coming off the spinal column and then coming down and then obviously going down in your leg and making all the way down into your foot. That's massive. I mean, I remember when I did gross anatomy and I looked up like, what the heck is that big? I thought it was a muscle, and the anatomy professor's just like, no, that's the sciatic nerve. I mean, that's how big the sciatic nerve is. And, you know, you can see how big the notch, what we call, this is called the sciatic notch, how big that has to be for that nerve to come down through. So that's pretty insane how big that is. I always thought like, wow. And this is a better view of the spinal column. Nice big one here. Like I was saying before, when you bend forwards, this whole orange part, your sacrum, starts to move. Moves in the opposite direction of your spine. So your spine goes one way and the sacrum goes the opposite. Just like with the ilium. And the ilium, they rotate one way, and you know, depending on, you know, you can rotate one here or you can rotate one here, and so one is stabilized in place while the other one is moving around. So that, you know, when you think about it, that's kind of pretty cool, realizing that, you know, for me just to do this movement means that one side of your hip is locked in place, all right, and the other side's kind of moving up and down a little bit with that hip. So the hip's going up and down, that knee's going up and down, and this hip is kind of obviously I can't do it because this thing is all screwed together, but this kind of will rotate on itself. You can have opposite rotations while one side's fixed, the other one's moving. So that's always a cool idea. And when they don't do that, you're in trouble because you're probably in a lot of pain. BET saying R3 Healthy, how you doing? Give me a second. I'm going to shout out to YouTube. Boom, there we go. We'll see if that makes a bit of difference or not. I know LinkedIn, I don't get nothing. I've been on LinkedIn for years, and it doesn't matter how much I put on there. I don't get any generation from them at all. It's just for me and my content, it's not a very good platform. I'm almost thinking about deleting it again. I got 6 in the house. Do you guys have any questions at all in regards to the hip or the SI joint? All right, at the very end of the sacrum. So this sacrum is basically fused. It's got all these bones all fused together. Now, one caveat to that is this. Sometimes you can, when you're born and you grow up, some people don't have a fused S1, S2, 3, 4, and so on, these little bumps I'm talking about. You can have a disc between S1 and S2 like you do in your spine, but it's a small disc. But you know, people have abnormalities, and one of them is that S1, S2 disc there, and that can get irritated. People all think it's an SI joint or a back problem, and it could be just that darn thing. And as we move down to the end, we have this thing literally called your coccyx, or tailbone at the very end. And you can fall and break that. I don't have LinkedIn. Yeah, I have it, and I've used it for years, BET, and I've tried since November, you know, putting my content, sharing it to that. I haven't got nothing. Big fat goose egg. If you break this coccyx off, they're not going to screw it back on. It's just going to float around in there. And that's about it. You'll be sitting on a donut for a while. And you definitely won't be doing any sacral sitting on your tailbone. You're going to be sitting on your butt bones because it's going to hurt too darn much. Word to the wise. Don't break your coccyx. I want to say nice. Nice to you. Do you have any questions, Nicole? How about, oh, I got 7 again. Woo! See, if I can get that 8 to 10, all of a sudden, a lot more people start coming in. It's quite interesting. But that phenomenon just happened. It does happen. Oh. Question. Does anybody know what this thing is? Or what's it do? What's this thing do? I should probably just say that. People might not know the name of this thing. Does anybody know what this thing does?
And I might eat baked potatoes or baked photos. I might eat baked photos.
No one knows what this is. Well, this thing, you put it on the end of your finger, like so, and it tells you what your heart rate and your oxygen level is in your bloodstream. And so right now I'm at 98% oxygen, and my heart rate's about 68. It's not bad. I've been having some caffeine, some soda, so my heart rate's going to be up a little bit more. But you always want your oxygen level to at least to be at 90 or higher. If it gets below 90, you're starting to get what's called hypoxia. You don't have enough oxygen in your bloodstream. Something's wrong. That's what's happening with pneumonia. So COVID, stuff like that, people with respiratory problems should have what's called a pulse oximeter, because that's what this thing is. Test your heart rate. I mean, most fancy watches nowadays test your heart rate, but this thing also tests your oxygen saturation level, how much oxygen's in your blood. So that's what this thing is. Yeah, you put your finger in it. Take your pressure or temp. No, it doesn't take your pressure. To take your pressure, you have to have a cuff of some sort. Because your body, the pressure of the cuff versus the pressure within the vessels, and that's how your body, or that's how the measurement is taken. This uses infrared light at the capillary level of your fingers, and you have to have warm fingers for this. You can't have cold fingers. This thing won't read correctly. And so you just put it in your finger, put it on your finger, and there you go. And within less than 10 seconds or so, you got your oxygen and your heart rate. Oh, you're welcome, R3. Do I have a link for the pulse oximeter? No. You could probably, nowadays, you could probably get this off of Google or Amazon if you typed it in. It's called a pulse oximeter. And they come 100 different colors and shapes. But the small ones, you could probably even get it at Walmart. They still have them. Everybody got the COVID idea and they all freaked out. I've had this for years. They went out and bought one, But if you have any type of asthma, if you're a smoker, if you're on oxygen at home, or your CPAP machine, emphysema, COPD, you probably should have one of these. They're only like, I don't know, I got this years ago. I think it was like, I might have paid $25 for it. I can't remember. I know it wasn't much more than that. Oh, I got a new one. Zakir. Hello. Oh, African France. Hello. How are y'all doing? Thanks for coming by. Come and get connected. I got a bunch of people in here. I got 8 in the house right now. Like I said, you get that witching hour after 7 o'clock. You start seeing some people come in. Can you type that in the chat? Yes, I can. So it's called pulse oximeter. OX. Yeah. OX. There you go. Pulse oximeter. So, people who are getting the COVID-19 that are a little bit that have symptoms and obviously breathing issues, this is kind of like the telltale sign whether you need to go to the hospital or not. If you're having shortness of breath and if your oxygen level gets below 90%, then that's kind of like bells are going off. You don't have enough oxygen in your bloodstream and you're going down, which is not good. So this is kind of really handy to have around for that as well as any other time. Kind of like, you you have a thermometer in your house to check your temperature, right? This is really just the next step. You should have that as well as you should have this in your house. It's cheap. It's got batteries in it. Change the batteries out. This thing will last a lifetime. I'll probably never have to buy one ever again. And they're about the same size. They used to be, we're talking 10, 15 years ago, they used to be giant, these pulse oximeters. They were probably that long and that wide, and they did the exact same thing as what this little tiny thing does. So over the last 10, 15 years, the technology's been miniaturized. Oh, you're welcome, R3. African French says, hey. R3 saying, hello, hello, hello. Thumbs up, thumbs down. Seven in the house. 6 in the house. I'm dropping down again. I can't get to that 10. I guess I don't do enough of it. There's live streams. I know with my friend Gore, when he's been doing live streams basically every day, and it took him about 2 weeks, 2.5 weeks, him doing it every day. He started to get a lot more people coming into his channel all the time. I just don't want to become a live streamer YouTube channel. I love live streams. I like educating, but I also want to do my shows, my content. So I'm kind of torn, kind of doing both. If you guys have any questions on the hip at all, or the pelvis, or actually as I turned around here and I did the SI joint and the sacrum and the coccyx too, any questions at all with that? I can go ahead and run up the chain a little bit here. I talked about this last night a little bit. I didn't go in great detail of the lumbar spine or lower back, or technically it's called the lumbar spine. And it's made up of 5 vertebrae. You got 1, 2, 3, 4, 5. So we have 5 spines, or spinous processes on the back. We have 5 vertebrae bodies. We have a disc and then another vertebrae body. So this would be, pull out that kind of section and there you go. You could say this is L1, L2, 3, 4, and 5. Thank you, Joe. Soon, Joe. Same here, exactly. Yeah, when you're talking about, people coming to the channel, it's tough. And there's lots of distractions, I hope my channel not only brings subscribers and small YouTubers together and connecting, but also gives you guys some information too at the same time, versus just, reading at the phone saying, oh yeah, R3 connect with, with Brown BET, BET connect with Nicole. I mean, you could do that, but I want to do something, also that you guys, hopefully, if you have any questions, maybe it can help you or help the loved one, or maybe, maybe it might open up a question that you might have had or something like that. So that's the reason why I like to do the live streams like this versus just, reading off my phone or maybe having a crazy background and just talking. So anyways, I found like I like to do this, and I'm hoping it helps people. Got 6 in the house. the discs themselves and the lumbar spine are the largest in the entire body. Literally, as we go from the neck all the way down, everything gets larger. You need something larger to support the body. The problem with the lumbar spine occurs at L5S1. This last disc, where everybody has a problem with, including myself, is because it's a wedge-shaped disc. All the other discs in our spine are like this. They're horizontal with one another. Because of how the pelvis is and how your sacrum is, it's tilted. So that disc is tilted. So it already has a lot of shearing forces going on in that area. Plus, 50% of all your movement occurs at that last disc. Of bending forwards and extending backwards, 50% of all your movement occurs at that one spot. It's not the greatest design, as well as it has a lot of mobility and less stability. I notice a lot of people you have grown with do not come support you. Yes. Yes, BET. That's exactly right. Yes. I notice a lot of people you have grown with do not come support you. Yes. Yes. I mean, that's the reality. I mean, I go to a lot. I mean, I don't hit everybody every day because I have a lot of subscribers, but I've gone to a lot. I mean, and you guys can all test this. I've been to R3's channel. I've been to BET's channel. I've been to Happy's live streams. I've been to Nicole's stuff. You know, I've been to all the, yeah. I can name off the top of my head a lot of people that I go to pretty regularly that don't come to me at all. Like, whatever, you know, I keep going to them and hopefully, you know, if they like my content, they'll come to me. I don't want them to come to me just because, you know, I see their stuff. Hopefully they'll come and see mine. And, you know, obviously, you know, you wash my back, I wash yours. But, yeah, you know, I just don't want people to get, you know, them getting irritated when, you know, I don't know, no one's coming to see me. You know, I saw that one day on Gype's channel where he, you know, he put out a post where he was upset because, you know, I don't know what happened. You know, he didn't get the 9,000 subscribers or some nonsense at that point, and he put a couple swear words in his text. He was all upset because either, you know, people gave him thumbs down or something like that. And I'm like, you know, buddy, you know, grow up a little bit. You know, put your big boy pants on. Yeah, not everybody's gonna like your stuff. Not everybody's gonna like my stuff. You're gonna get people that leave. He's got 9,000 subscribers, or close to 10. I don't know what it is. He really ain't got much to complain about. He's doing well. Oh well, you know, the reality is, you know, it's all about consistency. You know, it might be another 6 months, BET. It might be another year or whatever of us doing this before we start to hopefully see a little bit more if we keep improving upon our content and our channel. You know, I think Nimitz said once that he's a big guy. He looked at some stat. He had his what was it? Probably at least a month ago now. One of his videos was on, you know, what can someone expect after 100 videos or after 200 videos? You know, when it comes to, you know, someone watching your view, you know, your view count, excuse me, your subscribers and being monetized. It's like 150 to 175 actual videos made before, on the average, that you're monetized and you have consistent viewers coming to your channel. So I'm about halfway there, and that's kind of the standard. It's not the norm for everybody, but that's kind of, if you took everybody across the board, that's kind of the standard. I know, BET, you know, well, unfortunately, sweetie, this is life, and not everything is right in life. You know, you just gotta, you know, put the steel shirt on, you know, take the porcelain off the body so you're not fragile no more, and just keep going. You know, there's tons of people that quit YouTube. You can look on YouTube's statistics on people that quit. I think it's at 3 months, and at 6 months, it's kind of like the big drop off for people. You know, when it comes to what they upload, how much they upload, and how consistently they are at doing it. It really drops off at those two benchmarks. So, do you remember how we got connected or where? I'm going to say that we got connected with Milda family, if I remember correctly. I think it was that. Or it was either them or was it it wasn't RV, was it the people that the bins busters or whatever they call it, where they go to these different places that are, you know, that they can bid on bins and stuff like that with their stuff that's inside. I'm not sure if I saw you where we got connected there. I don't think it was Gore Mektar. I don't think it was him. I know one genre or niche that does not do well for me are video gamers. Like, there's tons of video gamers out there, and they've connected with me, and I've connected with them, and it was like, that's right, I didn't hear nothing. It was crickets, if that. Never came back. And small ones, you know, people with like 150 subscribers, like, or 200 subscribers. Like, okay, you know, yeah, those I don't even go to them no more. I did that for probably 2 or 3 weeks. That was a big fat waste of time. So I digress back to the spine. And so you have your nerve. People always think the sciatic nerve is the big one. Yes, it is, but you have the femoral nerve in the front of your body that comes down the front side of your leg. That can give you a lot of problems, as well as the obturator nerve that you don't hear about much. That's on the inside and down the front side, inside groin area. And those other two large nerves also get a lot of their connections from the lumbar spine, the peripheral nerves. And so, was it Bluegrass Picker? It might have been. I've been to Bluegrass Picker a bit. It might have been from them. It could have been. That's a good possibility. I just had to reset. We got 6 watching right now. Okay, let's see what else. So this lumbar spine. So those are the 3 big nerves in this lower back area that kind of come down into your legs and make up the rest of the nerves all the way down to your toes. Now, as they come down in your leg, they're named different things, but it's really the origin is way up high here. And obviously, if you want to talk about the origin is in Scully's head, right where that brain is. That hole coming out that I'm looking through is called the foramen magnum, and that's where the brain stem comes down, the spinal cord, the brain comes down through into the brain stem, and then makes up the spinal cord all the way down through. Sorry, Scully. Scully don't like when I do that. My battery died, but I'm still here. Casa. Hi, Casa 1. I haven't seen you forever. Thanks for coming. It's funny, if I could get all these people that come to my channel coming all at once, I probably had, I don't know, probably at least 10 or 12. I only got 7 thumbs up, but I know I've had more than 7 people on my channel. It's our healthy bit as. Wow, that's a tough one. So, those are the 3 nerves that make up basically going down in your legs, the large ones anyways. Now, this lumbar spine, like I said, has a lot of movement. Doesn't it, unlike the mid part of your back that has the ribs stabilize everything, the lower lumbar doesn't. It relies on all the muscles either along the spinal column, the abdominal muscles, or the big meaty muscles that are going from your hip to your spine, like the quadratus labrum muscle, the hip flexor, the iliopsoas muscles on the front side, all helping to stabilize when we move our bodies around. Joey, my lower back, it hurts in the morning. After I'm up and moving, it goes away. Do you know what that is? I know I'm getting old. Lots of laughs. All right, Mom. I've already told you what that is. That's arthritis. And that's probably arthritis at your L5-S1. And where's the arthritis really? The arthritis is in the facet joints. It's the joints along either side of one bone gliding on the other. So think of this as one giant joint and the other giant joint below it and the disc in the middle. And when we flip you on the back side, they glide with one another, these 2 bones, by these joints on both sides. These joints have cartilage on either side of them so they can glide on one another. And they also think of them as they're surrounded in this kind of like capsule, and it is ligamentous, and it keeps itself nourished by synovial fluid. And so that synovial fluid moves in and out with reduced stress and motion. The old term was motion is lotion. And what that means is that the synovial fluid moves in and out of the joint. That's not a static position. So when you're in bed in static positions for prolonged periods, the synovial fluid is squeezed out. None of the healing properties to keep the thing lubricated are in at the time until you get up and moving around. The synovial fluid kicks in, gets in that joint, and next thing you know, you start to feel better. That's called facet syndrome. And that's probably what you have. It's what I have in my lower back too, and I'm a great deal younger than you. I would have to say that you probably need to play with the sleep number bed, either increasing it all the way up a night or 2 and see how you feel, and then dropping it down by 10 or 15 points each night and see how you feel with it. Basically, process of an elimination to see what number fits you the best. Realizing those sleep number beds don't stay at the same number pressure too. Probably once a week you need to sit on the bed and just reset it to what number you have so that you have the exact pressure that you had at the start, because over time it loses some of the pressure within that bed system. Six in the house. You're welcome, Mom. So That's the facet joint syndrome. Now they can also do a lot of times if you do physical therapy and that doesn't help. What you really should do is probably go back to the doctor. They'll do what are called facet injections. Basically, it's just what they do. When I talked about the hip earlier, they do 1% lidocaine and they do a Depakote injection, which is a steroid. They mix the two, and they will go ahead under what we call fluoroscopy, which is a live X-ray where they'll have a lateral view or side view and a back view of your spine on two different monitors, one side and one on the other. They take this hollow needle, literally it's hollow inside, they'll put it down along that joint area, that facet joint, and then they'll put the medication through that hollow joint and lubricate and bathe that joint in numbing agent, which is the lidocaine, and the steroid, which is the Depakote drug. Or they could use prednisone or dexamethasone. There's a couple other types of medications that are different steroids. Essentially, they're all doing the same thing. They're reducing inflammation around that joint. And a lot of times, facet injections can help your symptoms if physical therapy or going to the pool or whatever didn't help reduce your symptoms. Yeah, I'm kind of getting tired though. I mean, getting tired of watching me or just getting tired yourself? The reality is, as we age, our disc naturally flattens out. Good old gravity, hormone changes. It basically the disc itself, which is consistency of wet seaweed, starts to dry out and becomes dried out seaweed. So your disc becomes dehydrated and flattens out. That affects the back side of the joint very much so, versus when it's nice and hydrated, it's much further apart. And so that DDD, that degenerative disc, isn't your problem per se. The secondary problem from that is all the joint inflammation that you can get and the stress of the joint on the back side, because the height of the bones aren't the same as they used to be. And you don't have that nice compression all the time because the disc is old and can't take the beating like it used to. And that can give you a lot of symptoms on the back side of your lower back. Should you get shots if it doesn't happen only in the morning? Probably not. And a lot of times, if it's only in the morning, the doctor's probably going to send you just to physical therapy. Probably educate you on certain things, give you some stretching exercises and stuff like that. No more than I could probably do, obviously, because lo and behold, I am a physical therapist. So if you remind me, I can't do it. I'm off from work tomorrow, but I could do it through the computer here. Maybe I could send you some stuff that you can do in the bed that can help you a little bit. Some stretches, some basic couple stretches that might actually help your lower back in the morning. So let me put that as a note. What exercises help? Yes. Some exercises help, yes, if you do the correct ones. If you don't do the correct ones, you can get the thing worse. And that's the reason why my whole channel is literally focused on that. I go over different treatment techniques that you can do at home that are physical therapy based, whether it's TENS unit, stretching or strengthening exercises, taping techniques, different massage techniques with different types of tools like a Theracane. I go over, the ice pack, the cold pack, how to use a TENS unit. I mean, my channel is really focused all around that. And so you can look through my playlist, and I continue to make new stuff, as well as this next video on Sunday is going to be the first installment of a series for snapping hip syndrome. Help you with what? Nicole, sometimes I'm confused at your statements or what you're asking. 3 exercises I'm going to send to her: the piriformis stretch, single knee to the chest, the hamstring stretch. Okay, so we've talked about the lumbar spine, the nerves of the spine, the discs themselves. Now, disc is a funny thing because the disc within itself has no nerve endings. So when you have a tear within the disc itself, you're not going to know about it at all until it starts. Either this is flattening out so much that it's causing stress on the joint, which is giving you pain, or you have a tear in it and it starts to pop out on the side and it starts to irritate the nerve. You can get that. The disc will do that. But if it doesn't, and that disc is just kind of sitting in there, and you've gotten that facet joint symptoms or muscle pain or whatever, calm down, you can get an MRI, and you're going to see probably at least 60 or 70% of the public has a disc bulge, maybe even a disc herniation, or an old one that's been scarred over. So there's a lot of false positives with MRIs when it comes to disc problems, because the reality is you can have no symptoms and have a disc shown on an MRI to be an issue, but it's really not where your symptoms are coming from. So be mindful of that. If you have a back issue and you get an MRI, and the MRI comes back and says that you have a bulge or you have a herniation, that's not alarming until they talk about where it's constantly compressing on what we call the thecal sac. And that is the outer rim or the outer part of the nerve. If that disc is constantly pushing on that part of the nerve, then that's an alarming. Or if the disc is flattened down so much that it's closed off where the nerve comes down through, which is called stenosis, the narrowing of a canal. In this case, where the nerve comes out through, because the disc has gotten so flat and old, then that can start to give you problems. That's the problem with that degenerative disc. If you can get it to inflate back up, voila, you got a lot more room for the nerve, as well as you got the joint where it should be. So yes, as we age, discs suck. All right, folks, it's a little bit after 8 here. I'm going to go ahead and call it if no one has any other questions. I'm going to be doing another live stream tomorrow. I'm probably going to do it, I don't know yet. I'm going to see how I feel in the morning. I might do it in the morning. I might do it at midday. I'm not certain yet, because it's the first time I'm doing it on a Friday and I have off tomorrow, so I want to see how well it goes. All right, and so until next time, Scully and I always like to say, look up and keep smiling. Bye, folks.